a tutorial on how PPE or personal protective equipment is used in the field. Right now we're going to talk about donning, aka putting PPE on. People don't don and doff PPE all day long, so we need to every so often retrain them so that their confidence stays high. You always want to have two people when you're donning and doffing so that one person can watch and give suggestions or ask questions. The first step is you're going to grab the Tyvek suit and put it on. Awesome. Good instinct to take your shoes off. Now, side note, Harrison has never done this before. This is a perfect training mock-up. So next, you want to put on your boots. So one thing to think about when you're donning booties on, imagine you're dealing with a substance and it falls down. The way Harrison's got it on now is it will fall into his shoes. The preferred way to do it is to pull that boot leg out and actually tuck your booty under it. For an extra level of precaution, you can always add tape to seal the lines. Let's go ahead and put that respirator on. We really want to make sure that the respirator seal is really good. Putting it on before you put anything else on your head is always a good option. You want to make sure it's open, make sure the two straps are underneath your hand, place it to your face the best you can. It doesn't have to be perfect at this point. You're focusing more on the straps. Excellent. Bottom strap first. He's putting it to the back of his head. Second strap to the crown of his noggin. Exactly. And now you want to pull the top and bottom, Harrison, at the same time to get that full extension. Does it feel pretty good right now? And notice he's not shaved. Don't do this. Now take your two fingers and massage it down so it's shaped around your nose. Excellent. And then I want to get a good look at all of what's going on. It's looking pretty good. Okay. Now do the negative pressure test where you breathe out. Do you feel any leakage? Do the in. Do you feel any leakage? Excellent, so let's continue. Let's go ahead and put your goggles on. The goggles are similar to the mask, where you want to make sure the seal is really fit, but you don't want to move the respirator as much as you humanly possibly can. But if you do move it, you just want to readjust to make sure there's a good feel. You can even do a negative pressure test again. Just make sure it's all good. Nice. Harrison's nailing this. Good job. Okay, it's coming over your goggle just a little bit if you want to push it to the top for comfort. Excellent. You have these gloves that are extended cuff. For a clinical setting, you just want enough so that it's a little bit shorter than the second glove that you're going to put on. And remember the same thing as the booties. And now we'll take a second pair of gloves and put them on top. One, you get double protection, and two, say you're working with different specimens over time, you can take the top pair of gloves off and put another fresh pair on. You can even hand sanitize the gloves before putting a new fresh pair on, just for a secondary method of sanitation. So one option is you can take the second pair of gloves and put it on top of the outside, so you put the arm sleeve right in between the two sets of gloves. Or you can keep it on top. Just make sure when you do have to take them off, you have access to that bottom portion. We're gonna put on the gown. Nice. All right, and you turn around, I can tie it for you. Excellent. Okay, and I put it in a bow shape, and that's mostly for the doffing afterwards so that he can doff by himself.